After age 77 signs. Your lungs are weakening. Do not wait until you cannot breathe to see a doctor. Every day, an adult breathes about 20,000 times. Most of the time, we do not even notice it. It is only when we feel short of breath or have a persistent cough that we realize how vital our lungs really are. After the age of 70, the lungs age. Just like the heart, the brain, or the joints, lung tissue gradually loses its elasticity. Respiratory muscles become weaker. The ability to exchange oxygen decreases over time. If combined with years of smoking air pollution or conditions like COPD, asthma, or heart failure, lung function can decline even faster. The concerning part is that many lung diseases progress very silently. At first, it may just be a few coughs, a little bit of shortness of breath, or feeling more tired than usual while walking. Many people think to themselves, I am just getting older. It is normal. But sometimes those are the first signals of a more serious problem. In today's video, we will explore 7 warning signs that your lungs may be weakening and what you should do to protect them. Sign number 1, shortness of breath during activities you used to do easily. This is the most common sign. If perhaps you used to walk around the neighborhood park every morning previously, you did not feel tired at all. But in recent months, even a short walk makes you stop to catch your breath, or climbing a few steps of stairs leaves you winded. Do not be quick to dismiss this as just old age. It is true that physical capacity decreases over time, but if the change happens quickly or clearly affects your daily life, you should get checked out. Shortness of breath can be related to many causes: lung disease, heart disease, anemia, or a decline in physical fitness. Well, the important thing is to find the cause as early as possible. If shortness of breath occurs even while resting or is accompanied by chest pain, bluish lips, or dizziness, go to a medical facility immediately. Sign number 2, a cough that lasts for several weeks. Coughing is a natural reflex that helps clear the airways. If you have a cold, the cough usually subsides after a few days or a week. But if a cough lasts for many weeks without improving, you should not ignore it, especially if the cough occurs every day. Happens more frequently at night, produces lingering phlegm, involves coughing up blood, or is accompanied by weight loss or a fever. These are all signs that need to be evaluated by a doctor in older adults. A chronic cough can be related to chronic bronchitis. COPD, interstitial lung disease, acid, reflux, or many other conditions. The important thing is not to self-medicate with cough suppressants for a long time without knowing the cause. A cough is a symptom. It is not the disease itself to treat it effectively. You must first find the right cause. Sign number 3, coughing up more phlegm than before. Have you noticed that you have to clear your throat or cough up phlegm every morning? Or is the amount of mucus increasing? Many long-term smokers assume this is normal. In reality, a persistent increase in phlegm production can be a sign that the airways are inflamed or damaged. Normal phlegm is usually clear or white. If the phlegm turns yellow, green, brown, or has blood in it, you should see a doctor. Besides the color, the amount of phlegm is also very important. If you have to clear a lot of phlegm every day, or if it is very thick, it shows that your respiratory system needs an evaluation. Especially for those with COPD or bronchiectasis, a change in the color and amount of phlegm is sometimes a sign of an acute flare-up that needs early treatment. Do not just think I smoke so. Coughing up phlegm is just part of life. Any persistent change in the respiratory tract deserves attention. Sign number 4, wheezing, or a whistling sound. When you breathe, have you ever heard a small whistling sound when you breathe? Or has a loved one noticed that every time you exhale, it sounds like a tiny whistle? This is called wheezing. This symptom appears when the airways are narrowed or obstructed, making it harder for air to pass through. In people over 70, wheezing can be related to many causes such as chronic obstructive pulmonary disease, asthma, respiratory infections, heart failure, or other lung conditions. Many people only notice wheezing at night. Others experience it after walking fast or doing heavy work. Initially, they often think they just have a cold or a sore throat. But if the symptom persists or recurs many times, you should not buy over-the-counter medicine, but should go for a lung function test. If wheezing is accompanied by severe shortness of breath, bluish lips, or the inability to speak in full sentences, seek emergency medical care immediately. Sign number 5, chest pain. When breathing deeply or coughing, chest pain does not always come from the heart. In some cases, the pain may be related to the lungs or the lining of the lungs. You might notice the pain increases when you take a very deep breath. Coughing or sneezing also makes it hurt more. Some people describe the feeling like a knife stabbing one side of the chest. This symptom can be seen in pleurisy, pneumonia, a pulmonary embolism, or many other conditions. Of course, chest pain can also be due to muscle strain, rib joint pain, or benign causes. But if the pain persists and is accompanied by fever, a heavy cough, shortness of breath, or coughing up blood, you need to see a doctor right away. Do not just endure it or only take pain relievers. Determining the correct cause is always more important. Sign number 6, unexplained weight loss and constant fatigue. This is a sign that is very easy to overlook. Many people are happy to see the numbers on the scale go down, but after the age of 70 unintended, weight loss is rarely a positive thing. If you have not changed your diet or increased your exercise, but still lose several pounds in a short time, pay attention. Some chronic lung diseases cause the body to consume much more energy. Just for the act of breathing, patients eat less because they always feel tired or short of breath. Over time, muscle mass decreases, physical mobility also declines. Additionally, prolonged weight loss can be related to many serious illnesses, including chronic infections or cancer. If weight loss is accompanied by a persistent cough, shortness of breath, chest pain, or coughing up blood, you absolutely should not delay. Seeing a doctor in seniors early, detection always makes treatment much more effective. Sign number 7, bluish lips or fingertips. This is one of the most serious warning signs. Normally, oxygen-rich blood creates the natural pink color of the lips and fingertips, but when the oxygen level in the blood drops significantly, the lips or fingertips can turn purple or bluish. This condition is known as cyanosis. You may notice the lips are no longer as pink as they used to be. The fingertips or fingernails have a blue tint. The skin looks paler than usual. This is accompanied by a feeling of shortness of breath or extreme exhaustion. This is not a sign of normal aging. It can happen when the lungs are not getting enough oxygen into the blood, or when the heart is not pumping blood effectively. If bluish lips appear suddenly, especially with shortness of breath, chest pain, confusion, or unusual sleepiness, call 911 or go to the emergency room immediately. Do not wait to see if the symptoms go away on their own. Prolonged lack of oxygen can cause damage to the brain, the heart, and many other vital organs. Quiet habits that weaken the lungs after 70. The lungs have a very good ability to protect themselves. However, many daily habits can cause lung function to decline faster. The first mistake is continuing to smoke or frequently inhaling secondhand smoke. Even if you have smoked for many years, quitting now still brings benefits. Lung function can improve somewhat, and the risk of complications decreases over time. And the second mistake is a sedentary lifestyle. Many seniors sit all day because they are afraid of getting tired. The lungs' ability to ventilate also decreases. The third mistake is not keeping up with recommended vaccinations. Diseases like the flu or pneumonia can cause severe complications in people. Over 70, talk to your doctor about the vaccines appropriate for your age. And the fourth mistake is disregarding a persistent cough. Quite a few people buy cough medicine and take it for weeks or months. Meanwhile, the real cause could be a condition that requires specific treatment. The fifth mistake is long-term smoke from fireplaces, wood stoves, dust from home renovations, or chemicals in the living environment can all affect the respiratory tract if exposure is prolonged. The final mistake is not managing underlying health conditions. While heart failure, diabetes, obesity, or acid reflux can all make respiratory symptoms worse if they are not well treated. How to protect your lungs after age 70. The good news is that while age cannot be changed, you can still help maintain lung function through simple habits. And the first thing is to stop smoking if you still do this, is the decision that brings the greatest benefit to lung health. Second is regular physical activity, walking, light cycling, tai chi, or breathing exercises suitable for your physical condition. These activities help improve the strength of respiratory muscles and increase stamina. Third is eating a nutritious and balanced diet. A proper diet helps maintain muscle mass, including the muscles involved in breathing. Fourth is keeping your living environment clean. Limit exposure to smoke. Keep your home well ventilated and wear a mask when you must be in a dusty environment. Fifth is going for a checkup when you have lingering symptoms. Do not wait until you have severe shortness of breath to find a doctor. Many lung diseases, if detected early, can be well controlled and help maintain your quality of life. Finally, have regular health screenings, especially if you have smoked for many years or have a chronic lung condition. Summary: healthy lungs help the body receive enough oxygen to nourish the heart, the brain, and all other organs. After age, 70 changes in the lungs occur naturally, but that does not mean we have to accept shortness of breath or a reduced quality of life. Today, we have explored 7 warning signs that the lungs may be weakening, shortness of breath during activity, a cough lasting many weeks, an increase in phlegm production, wheezing, or whistling sounds, chest pain when breathing deeply, or coughing, unexplained weight loss and fatigue, bluish lips or fingertips. If you notice one or more of these signs lasting or getting worse, please proactively visit a medical facility for an examination. Do not assume it is just a consequence of old age. Early detection and proper treatment can help preserve lung function, reduce the risk of hospitalization, and improve your daily life. Thank you for watching the video until the end. If you found today's content helpful, please share this video with your family and friends, especially those over 60 or 70, so that more people can recognize the warning signs of lung disease early. Do not forget to like, subscribe to the channel, and turn on notifications to continue accompanying us in our series on senior health. Note: the content in this video is for informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you have symptoms such as severe shortness of breath, chest pain, coughing up blood, or bluish lips, please go to a medical facility or call emergency services immediately.